Are you? And we're getting closer to Q4. We're almost winding down. And this is tax time, right? This is where a lot of businesses look at their over bottom line, don't they?
Yes, I do. I'm living in the present. We don't want to move into the future too quickly.
Because we're not in October. But this is when people start to get looking at taxes. And it's when
about what are we going to do with all the next year? Because our health insurance rates are going up and our taxes, how do we avoid paying all these taxes for doing so well this year?
And that's where you go to Tom. Tom has other solutions, not just ClaimLinx, but that's going to be the first solution because healthcare, a lot of times you've seen situations where it's tax season and they're not utilizing how they use their healthcare plans for tax purposes. They make a lot of mistakes, don't they?
A lot of useless fear. A lot gets to make decisions that may not be up to par. Like my golf game, it's really not at par these days.
So what kind of mistakes do you see sometimes, especially at the end of the year in tax seasons when it comes to healthcare for the company?
They're only getting an 8% rate increase. We're locked in over already 50%. So now it's 58. Wow, that's great.
How else? Do you think it's sometimes when they put their bottom line to their accountants, they're missing things, loopholes and different things when it comes to how they purchase health?
I mean, they're missing all kinds of items they could be taking advantage of. The accountants, there's very few proactive accountants out there. Just there's very few proactive health insurance agents out there. So what people do is they do the status quo. They don't change because change is awful. Even though the whole country is about change, that's what this country is founded on. We didn't want to hang out with England anymore, but now they want to just keep everything status quo.
And when you see that specific situation, Tom, when you're talking status quo, you're talking specific things, I'm more intrigued by the fact that, what a lot of times companies aren't spending enough in healthcare. Even when they could decrease the costs later, that could be a tax write-off of their business. Or they say, we're not going to cover benefits at all. We're not going to look at the best situation for our company at the end of the year. We're talking a small business owner and stuff.
Small businesses, a lot of them don't purchase health insurance as a company. They don't think they can afford it. They don't realize that gives them a competitive edge. But yeah, they can absolutely provide a benefit package that's better than the big boys.
Have you seen some that have subcontracted employees where they're not employees, but meaning like part-time, covering benefits to attract them at all? Or have you seen that?
Usually not part-time. There's ways the part-time people can get their health insurance much more affordably too.
And that's going through you and then creating
or going through somebody who understands the income verifications and those things that can get you lower cost health insurance.
And that's for sure. And once, if they look at their bottom line and they see healthcare as one of their biggest expense lines, how many are going to see that very soon with their accountant?
How many?
Yeah, a lot is one of the biggest expenses.
Yeah, the accountants. But see, the accountants, instead of saying there's ideas out that could save you lots of money, just freeze up and say nothing.
And what do you think the reason is?
Because they're conservative people. The truth is, when I was in college, I was going to be an accountant when I first went there in Central Michigan. But on Friday nights, they were studying, and I'm like, what the freak is this all about? And they were too serious. I just couldn't take that. So I had to do other things.
Studying on a Friday night when I was in college? No, thank you. Studying on any night. Thank you. What did you major in college?
It was a business initially, but it was tilted towards the recreation. So it's commercial recreation and facility management. So I should be running Disneyland.
You can run your own Disneyland.
I do.
Exactly.
All right.
For sure.
I'm always out on Space Mountain.
So that sounds like Ric Flair. Shout out to Ric Flair. All right. So let's talk about the best thing people should look at first when they're as a business owner. What do you recommend when you first look at your health insurance to see if it's the right deal, if it's working out, all those things?
The first thing they should do is take their existing plan and ask the existing insurance carrier to give them their lowest cost options with the same network. And then they should get a smartphone or a calculator feature on their smartphone and do the math. And they go, okay, if we pay an employee by going to the lowest cost option, it costs us $5,000 less. and their out of pocket goes from $2,000 to $3,000. That's $1,000. If we're saving $5,000, we know that we're guaranteed to save $4,000 if we cover that person the same way. But wouldn't it make more sense to cover the two so they have a 100% plan and they're guaranteed to save $3,000? So now that you have employees who are asked, now they don't have any out of pocket where before they did. And the employer's happy because they pocket guaranteed $3,000 using the same insurance carrier that they were buying it from.
But how many of those insurance salesmen are going to make sure that they can get them to that plan?
If you're working on 5-6% of the premium as either a bonus or a commission or both, why are you going to show somebody, a group of 50, how to save $250,000 off their premium when what that costs you $10,000 to $20,000 of revenue?
Wow. I don't think they will.
And I sit there and laugh like, why are you guys so shocked by this?
Now, my question is specifically when you look at the plan and I'm already, my brain's blank for a second on what I had a great follow-up question that I'm going to defer to go to ClaimLinx.com, call Tom today.
Wrestling really did mess with your head.
Yeah. No, I've been doing some of the brain training. You got to use the meds. That's a great thing. I'm going to get a brain scanner next. Oh, no, this is the end of the day of calls. Okay. I've done a lot of podcasts and meetings. All right. Go to ClaimLinx.com today. Schedule a call with Tom. All right. That was the Cutting Edge Benefits Podcast.